Well, here we are. Thank you for joining us. My name is Orrin Ailloni-Charas. I am the managing partner of the Global Health Impact Fund and an anesthesiologist, and now currently retired. And I am with my good friend and our investee, CEO of Plethy, Raja Sundaram. Did I say it right, Raja? Did I get it?
Perfect.
All
You
right.
got it.
All right, the nice Brahmin name. So Raja, I'm really excited that you're here today. Thank you for making time in your schedule. My goal for our conversation today is to hear more about you and your company and the things you're doing and help our LPs and advisors and anyone else who wants to take a gander at this video understand what we understand about you, why we invested in you, and why we are very excited for your future.
No, thank you very much, Orrin. I'm absolutely thrilled to be here. Huge fan of the fund. You guys are our seed investors, and you open doors like crazy. So if I'm a physician or a healthcare professional, and if I'm not an LP at Global Health Impact Fund, it's time to call you.
Thank you for that. Raja, let's start with just a bio. Who are you? Why are you an entrepreneur? They say it's the loneliest profession. What are you doing?
I came out of Orrin. I came out of Cisco Systems. I was one of the senior execs in sales, and I cut my teeth in healthcare while I was there because if you remember, the granddaddy of telehealth was called Cisco Health Presence, and so I got an opportunity to carry the number and working with the teams, partner with GE Medical, Cerner, and UCSF to sell into large hospital systems. So through it, got an understanding of what you normally read in newspapers about healthcare. And I always was fascinated by it. Had left Cisco, was part of a group of startups. One of them notably is Virgin Hyperloop One. They did their first passenger test this week. I'm really thrilled for them. And this notion of managing care has always been in my mind. I've always thought about it in the context of how do you marry technology and clinical processes and deliver value in healthcare. So somewhere along the way, got a master's in EE, have an MBA at Berkeley. And so I thought, let's walk down this path of trying to build something on my own. If I can deliver value in healthcare, deliver outcomes and reduce costs while keeping patients thrilled, I've done my job. So this is not just a startup or a role. For us, it's a cause. We believe in the cause. Several of my team members gave up very lucrative careers because we all believe in the cause.
So there's passion. What specifically about the space, the musculoskeletal space, drove you towards that?
Yeah, we actually look at it as this notion of, when you look at Maslow's need hierarchy, you start thinking about food, clothing, shelter, and we added to it mobility, independence.
Yep.
Because we kind of looked at it as in a cliche way, saying, look, musculoskeletal care, joint health, gives you the opportunity to follow the path life takes you or forge your own path. And so if you're lacking independence, then there's enough studies by World Health Organization and others with regards to what it does towards developing chronic conditions later on, how it socially isolates you, mental problems, and the ability to have diminished earning potential for a prolonged period of time, right? And so we really thought about it as said, if you really manage foundationally, how do you do recovery, including home health program, exercise programs, then it becomes a foundation for recovery engine across multiple medical conditions. We felt if we were to start at the foundation, this is the foundation. Musculoskeletal care is the way to do that.
Okay, that's a really interesting way to look at it. Maslow's hierarchy. I didn't expect that to come up in this interview, but you are bringing me closer to self-actualization, so I appreciate that. Tell me, please, when did Plethy start, and who were your first couple of teammates, and why? Why is that the Avengers group to get Plethy off the ground?
Right. So we've been at it since 2018. We incorporated it a little bit earlier than that, and spent the time talking to hospital CEOs, CFOs, and physicians of various denominations, such as yourself, to seek to understand what problem to solve. So we didn't kind of walk in with, hey, here's a cool solution, let me look for a problem. What my team is composed of is, I call it our Geek and Greek squad. My co-founder came out of Stanford. He's a neurosurgeon in Ohio. And we're a combination of people who came out of the traditional Silicon Valley tech, think blockchain, AI, sensors, app, software platform. On the other side is folks who came out of J&J Dipiosynthesis, BD Biosciences. We have nurse practitioners on staff. So we kind of looked at it as a Geek and Greek squad because it was very important, like I said, to marry technology with clinical protocols and really deliver value in healthcare. And so, ergo, Geek and Greek squad, as you can imagine, it makes for fantastic internal team conversations, because the Greek squad wants to deliver something tomorrow morning, and the Greek squad says, I don't think so. Here's the quality management system that you have to follow. So it's fantastic because it delivers good outcomes on the long run.
That's really funny. So I guess it would be good for you to tell us, before we move too far forward, tell us about the Plethy recoup device and what things you're doing with it, why it's a market leader, why it has market leader potential, and just tell us your thoughts around that. And let's get into a little conversation about your product.
Yeah, when you look at musculoskeletal space, one of the challenges that has been there in the marketplace, top two challenges. One is access to care. Look, it's a very tactile medical field. And so it's always come on in the clinic and let me take a look at you. The second is, it's another, like many other fields in medicine, care requires transition of care across multiple care providers. And what we found was there was never a visibility into how the patient is actually recovering, particularly given today's condition where much of the surgery is same-day discharged. You're sent home within 24 hours with 6 sheets of paper to go manage yourself, right? And so we kind of looked at that problem and said, how do we look at mapping out the entire episode of care? And within that, how do we provide visibility to the care team with regards to how the patient is recovering, or intervene quicker if needed? So we started obviously with a sensor. And our sensor looks like that. And it goes on a body on a magnetized Band-Aid. So the patient wears it, removes it once a week. This is twice a day care session on any joint in the body. So we are able to do ankle, knee, ACL, MCL, hip, shoulder, elbow, lower back, etc. Same sensor, same solution. There is no band, there is no brace. The secret sauce within it is the algorithms that track range of motion. The ability for us to measure flexion, extension, adduction, abduction, and so on is exceptional. And our partner there is UCLA Computer Science and Biomechanical Lab, who validates our algorithms. That's our secret sauce. And we've gone through that experiential curve of testing it with real patients across multiple use cases to know that we are accurate. Now, why is that important? Because it connects to an app that takes the patient on a curated care journey twice a day. They don't have to look at 6 sheets of paper and wonder what they have to do this morning, whether it's tracking their pain, reminding them on their medication or their symptoms, or doing their home exercise protocols consistently towards their recovery. So on any given time, the entire care team understands how the patient is progressing, think value-based care. At the same time, if you need to intervene, it's very targeted with regards to what intervention means. And the really nice thing about it is the ability for the clinic team to do contralateral assessments. How is the left shoulder versus the right shoulder? How is the left knee versus the right knee? Something that would have taken an hour's drive, wait for an hour to go see the clinician for 7 minutes to do the assessment, can all be done virtually, all of which is billable. That's really how we have approached it. So we, in real time to the clinician, both in the through a dashboard and an app, we give them very quick insights into how the patient is doing.
And does the clinician oversee the dashboard, or do you have an intermediary or an AI developed that does the work for them and sends them summaries of what's happening?
Yeah, what we send, so there is no point in doing, as a practicing clinician, you're very busy, and so is your MA.
Right.
Data deluge is not what we do. So what we found was that, to your point, the ability for us to parse through the information of how the patient is doing and take a curated message back to the MA at the clinic or the NP at the clinic on specific observations that we've made on the data so that they can make the clinical decision with regards to how to intervene, if any. And that's really how we've approached it. So the clinic has an opportunity in our platform to throttle the kind of alerts that they get. That way, this doesn't become overwhelming for them.
So I think what's important to underscore for people who aren't as familiar with the clinical experience of people undergoing joint care specifically, or orthopedic care, is how important compliance with at-home exercises and physical therapy is. If you, for instance, get a total knee arthroplasty and you don't exercise your knee and do range of motion exercises, you can get even like a frozen knee, right? So the compliance is critical. And in life, in corporations, right, we say if you don't measure it,
it doesn't happen. It didn't happen.
And so one of the things I like about what you're doing is you're measuring it, you're giving the information on a summary basis to the people who need to know what's happening, and you're giving it to them in a timing that they can intervene earlier and prevent not just they don't, it's more than just making sure people stay on the course, but it's actually preventing a bad outcome. Right?
You're spot on.
Right, and that's really critical. So there's an interesting, I think, nuance between the idea of telehealth and virtual healthcare. Maybe you can explain that a little bit and tell me where Plethy Recoup falls in that continuum.
Yeah, so when you look at telehealth, it's a very broad umbrella, right? And when you start looking at nuances in it, it's a question of, is it a virtual clinic visit through partners of ours in Global Health Impact Network, or is it actually getting the patient to do managing their own care, giving them predictability? Think short-term neuroplasty, wake up in the morning, brush your teeth, do your care session, right? And how do you drive that discipline day in and day out when no one's looking? One is synchronous in telehealth, where you and the care provider are communicating through a vehicle like we are using right now at Hansen. In our case, it's predominantly asynchronous. The patient gets to do their care session at a time that's convenient for them, minimum twice a day, and the care provider gets to view the patient information when they have time or allocated time within their schedule. And so it's completely asynchronous, but provides real-time telemetry at any point in time, to the point that you brought up earlier, which is if there is a positive symptom that needs to be addressed, how do you address it? But otherwise, it's asynchronous, really looking at how the patient is progressing on their care journey and making sure that the outcomes are what is expected.
Raja, does the patient also get access to their data so that they can watch their progress?
Absolutely, because we've always been a proponent of, this is the patient's data. We are merely the caretakers of it, and enabling them to be successful in their surgery preparation or recovery or non-surgical conditions as well. And so at any point in time, patients have access to their data. This is very important because, as we talked earlier, there are multiple care providers. Think the physical therapist, the home healthcare, the home PT, and so on. This gives them an opportunity to share that data with their various care providers.
So the patient can also get a sense of whether they're making progress or falling backwards. And it's almost a game for them, right?
It is. And look, I think this is a good time for us to kind of talk about how we keep patients engaged. You'll be quite surprised. There are patients, to your point, who are the type A's who want to make sure that they are on top of the leaderboard. But that's not everyone's cup of tea.
Right.
So what we do is we put a lot of emphasis on behavioral interviews when the patient gets onboarded, because we want to seek to understand what their support structure looks like. We want to seek to understand what their personas are, what is their tendency. And the app and the engagement of the app is custom tailored to their persona and tendencies. That's really how we keep patients motivated and engaged.
Okay.
And so every alert that comes from the app is written by a psycholinguist. So it's not the or and get up and do your exercises. Perhaps that is
I'm sorry.
your persona, your
I got
tendency.
on the word psycholinguist. I think I dated one in college.
So that becomes critical because it's a lot of micro steps that that gets patients engaged, and the way we go about doing that is getting them engaged. I think, like I was mentioning before, short-term neuroplasty. So they don't have, there's no guesswork. You wake up, you do your care protocol,
Right.
and it engages you.
Right.
And oh, by the way, it kicks you, depending on your persona, the right way, on getting you back on the horse if you've fallen off the horse.
So there's some patient personalization, which
Certainly.
relates to
So to a certain persona, it makes a huge difference for them to be on the top of the leaderboard.
right.
And certain personas, it's very important that they adhere to what they committed to, and we play on that.
So this is a class 1 exempt device. You are in the market.
Yes.
How many patients have used the Plethy Recoup so far?
So under the clinicians program, Reimbursement, we've done over 250 cases. What we did, Orrin, is we did cohorts of patients looking at one use case at a time. We started with knee replacement.
Mm-hmm.
As you can imagine, moved from there to hips, did bilateral hips.
Mm-hmm, mm-hmm.
Then we moved into ACL, MCL, then did ankle, then did shoulder, then elbow. So the hip bone connects to the tailbone. One joint at a time is the pathway. But we built a program with it, which is, it's not only does it work for surgical and non-surgical and chronic conditions, but we also validated reimbursements along the way for each of them.
Right.
So we are at a point where we have clinics with contracts live and going into the market with a program, not a science project.
Right. Right. Tell me about the patient experience, though. So have you seen the compliance, and have you gotten the positive feedback? What kind of leakage are you having in patients?
Yeah, our current population of patients, we are seeing about 80+% compliance. So think
Wow.
3 days a week, twice a day care session at a minimum. It varies, believe it or not, by the procedure and the joint in question. It's something that we are getting better and better at. Let me give you a simple example. You talked about knee and the importance of, you don't want to get into a frozen knee.
Right. Sure.
People understand that, and you will see compliance rates nearing 100% because we're very clear in educating the patient on the importance of them doing their home exercise programs. On the flip side, you would see patients who have had pain for a long time, say 7-8 years in a row. And as you can imagine, after the surgery, replacement of a hip is done, the pain goes away.
Right.
They're like, I'm cured, I'm going to go play golf. And so we become the mechanism along with the clinic to educate them. Yeah, not so fast. Here's what it takes to. And so we've consistently looked by procedure into patient adoption and targeted how we educate and engage patients by procedure, believe it or not. So think a high school kid who's like, wait a second, I just had ACL, my year is gone and my life is over, to someone who's very motivated on the Medicare age group,
Right.
to be independent, to go to church, to go to their family settings. And so we've really tailored our program by personas and tendencies.
What are you hearing from the doctors who've prescribed this to the patients?
They're actually thrilled. One of the things that I'm really grateful for is many of our surgeon partners are our references. Remember, we are walking into the Midwest or into really large orthopedic groups in the United States now, like Illinois Bone and Joint or Resurgence in Atlanta, who obviously aren't, with 100 surgeons, aren't going to immediately take it on. And what I found, what we are really thrilled about, is our early phase of clinics, orthopedic clinics, both recon, trauma, and sports orthopedic surgeons do get on Zoom calls with the CEO of these practices and give real-time testimonial with regards to what their experience and their clinic staff experience is, how simple it is to implement in the clinic, the engagement of patients, and how patients feel that they are connected with the care team. And
Right.
the third is the reimbursement models as well. So it's been fantastic. On the flip side, if you look at we have some videos more coming in on our website. Patients are like, look, if you want to, in weeks from after surgery, if you want to be scooting around, this is what you ought to do. My range of motion on my left knee is now exactly like my right knee. So it's been fantastic testimonials. And what really people like about it is the discipline that it gives them on what they need to do.
Right.
20-minute blocks twice a day.
Well, and feedback. I mean, I think that knowing you're doing it well and seeing yourself advance, or worse, seeing yourself not advance and feeling like you should be, I think is very motivating. And I think that's, I mean,
It is.
You
Look,
can't make them drink the water, but you can serve it up to them,
That's a very important point, because look, one of the things that we found in the space is there are a lot of patient apps that is there, right? Which is patient self-reported apps, which is, every day it pings and says, did you do your PT? Yes. Did you ice and elevate? Yes.
Right.
Did you? And one of the things large hospital systems keep telling us repeatedly is they see the patient 6 weeks post-op and they're still kind of limping in. So clearly the I did it every day is not working. And we've thought about it in the context of patient psychology. Look, your patients, Orrin, always wanted to please you. So if
they
you
sleep.
they were doing
They go
something,
to sleep. So.
right? They were when the block it took longer for the block to run out, right?
Right.
And therefore, right. And so what we found was that is primary reason why they keep saying I did it. In our case, back to what you said, trust but verify.
Well,
I know you said you did it, but I can see the data.
Was the objective nature of the data, right? It's not
Right.
Did you move but you moved 33 degrees. Yesterday you moved 25 degrees, and that's an improvement. And, strong work. Keep it up. Tell me, you mentioned reimbursement when we were talking about the doctors, Raja. I think this is one of the things that's so interesting about this. So, actually stepping back, when I talk to companies in the space, because we're healthcare investors, we always talk about the clinical impact first, the clinical path, the integration. To us, that's probably the most interesting and exciting thing. But everything has to be a business. Everything has to have the proper financial risk and not too much. And it has to all hang together. And if it doesn't, it's not a good investment. And I think one of the things we discussed before we started filming today was the nature of the reimbursement and the story that you can tell the surgeons and the hospital groups and so forth that you're talking to adopt and try the Plethy recoup is really very compelling. Maybe you could talk a little bit to that.
Yeah, the way we looked at the space was you can walk into value-based care and say, here's another cost line item, go save costs somewhere else, right? And the promise of something is going to go away. We initially looked at it in the context of this is service that a clinician provides. And it's a service business, which fundamentally means that if you're delivering service and it delivers value and the outcome, then you ought to get paid for it. So we started looking at it as a reimbursable model. And one of the big advantages starting in 2019, as you are aware, CMS started reimbursing not only for chronic, but for acute care as well, once there's a clinical necessity on remote patient monitoring. But on top of it, what we found was because of the sensor and the data and the fact that we can do asynchronous and at the same time do synchronous contralateral assessments and so on, gives the clinic more opportunities for reimbursement for services actually delivered. These normally would have been, think low margin clinic visits, which is come on in, I'm going to measure something, go away, or come on in and I will see you either on telehealth or see you in the clinic, which is a replacement, a lower cost replacement, albeit. We've found that the kind of data that we generate gives incremental opportunities for the surgeon from a revenue cycle standpoint. And that's a huge difference for us because, look, when you start thinking about physician fee schedule over the last several years, they consistently come down 7% in this space.
Yeah.
And at the same time, payers are, on one hand, very interested in getting outcome data, measurable data, which we deliver, and be willing to reimburse for it. Right? And so we are in the right place at the right time where you see the shift towards that's great, it's not patient self-reported, but is the patient really improving? And for delivering that care, I'm willing to reimburse. We kind of found ourselves in the right place. Yes, we do sell into value-based care and bundle payment models, whether it's Medicare-based or other conveners, where it is about knowing risk stratification of the patient. Are they really complying? Will there be bounce back? Will there be future costs? But that's more of a value-based towards cost savings mode. We found that preponderance of the procedures that the surgeon goes through is they are still in fee-for-service model, and we are able to enable them to deliver care and be rewarded for it.
Right. So said simply, they charge, CMS reimburses for the service that you provide, and money from that reimbursement goes directly to the doctor, and out of that money, they take money to pay for the service.
Yeah.
They net positive for each patient that they take care of using Plethy Recoup. So they make more money using Plethy Recoup rather than pay for the service and lose money.
You're absolutely right.
So if I have an orthopedic practice and I do 10 patients, I could increase my billing revenue per patient by X dollars times 10
That is correct.
for getting better data and hopefully taking better care of my patients.
Absolutely.
So that's a great model.
That's a great model. But to
Yeah.
think about it a little further, an orthopedic practice predominantly is a referral-based
Right.
service. So one of the things that we are finding is one, it's think of it as a revenue channel. The second is massive referral opportunities. We find that we have patients who go on Instagram and Facebook and they say, "Look, I'm using Plethy Recoup. Dr. So-and-so is the one who prescribed. He or she is on the cutting edge of technology and care. This is who you need to go to." And that makes it circle around their friends and family. And the third thing that we found, interestingly enough, is we found that the calls to the clinics from patients started reducing. Two simple reasons. If it's a surgical case, pre-surgery, there's a huge boatload of questions. Should I? What soap should I use the previous night? We make it very simple for the patient, kind of spoon feed them by timelines as to what they need to do and check it off. And post-surgical, there are what you would call concern questions. Wait, it's warm. My surgery site is warm, and other symptoms.
Right.
We give them the opportunity to very quickly report their symptoms and get addressed if need be. Otherwise, be able to at least comfort it that yes, we saw the symptom, nothing for you to be concerned about. Gives patients peace of mind as they go about their care journey, right? Their recovery protocol. And so it's a revenue channel. It's a great way to get more referrals and clinic flow through. And third is huge emphasis on these calls that an MA is fire drilling to go address.
Right.
Kind of goes away. And so it's been a great proposition for the surgeon partners who have adopted it.
That's fantastic. You have pretty aggressive revenue projections. Why don't you walk me through those?
Yeah, so we just started walking down commercialization this year, right? Towards the middle end of this year. As we look at 2021, we see two things. Number one, the sheer volume of patients. Remember, this is 1 out of 2 of us here in the United States have a musculoskeletal problem every year, that we either go to a primary care provider or to an orthopod or a rheumatologist. And on top of it, what we found was there's backlog from 2020 that's kind of moving into 2021. Remember, many of the patients who we had surgery, this is elective surgery, are now postponed into December and into early next year. So when we look at our traction and contracts that we already have in our pocket signed, and looking at them and being able to see what that would mean for us, and the kind of clients that we're talking to, the really, really large orthopedic groups and PCP networks at the space, we are very confident in terms of hitting a very aggressive goal into next year. Because the advantage that we have is we are no longer hey, go pilot this. This is a nice thing and see if it works for you. We are walking in with a program. We're saying, look, this is what it does. This is how it benefits you. Oh, by the way, this is your reimbursement models. And here are validated codes from private payers and from Medicare, all bundled together in a nice bow as a program that they can go implement. So we've taken a lot of time to go sort out how to implement this inside a clinic with very, very minimal friction, how to ensure patient engagement and adoption occurs, and how reimbursement flows through. So we're kind of at a point where it's a nice package. Take the package, unwrap it, roll it out. Your patients are happy. You have very good insights into how the patient's progressing and data that both employers and payers want. And at the same time, you get reimbursed for services that you deliver. So that's really why we're looking at 2021 with a keen eye, because that's our year. We're running like crazy.
Very good. So what are the next big challenges for Plethy? What do you need to do? What are your next milestones?
So I look at it in the context of both sales, go-to-market, and also R&D, because we're not going to stop inventing. So let's start with the first one. On sales and go-to-market, the ability for us to scale quicker, faster, and be in front of orthopedic groups and PCP networks is where our emphasis is on. So we have a couple of choices. One, what we are doing with direct sales into the large clinics. At the same time, we are in conversations or have signed up distributorships who exist in the orthopedic space. Our current focus beyond that is what are the right strategics who we want to partner with. We are in very, very active discussions with 2 orthopedic manufacturers, among others, and 2 conveners here in the United States. And so it's going to be a choice point that we have to make, or with regards to who we make our bed with and who we go to market to get the reach that we need across the states. At the same time, from engineering standpoint, look, if we look at it as going back to Maslow's need hierarchy, our next generation of it has to be more use cases, because we've never gone into pediatric orthopedics. We found a huge need for management of scoliosis for children, as an example. And we've gotten people knocking on our doors on it. We want to be able to address that, because look, that's kind of why we got into this business, right? At the same time, we also want to get into gait and balance related issues. And the way we want to do that is by augmenting our sensor with Vision AI, just using the phone and algorithms with it. So we all have a smartphone. Here's a sensor, a combination of sensor plus algorithms in the phone. And we've already started some of these development efforts which we want to take into. So we're going to go deeper and deeper and deeper into musculoskeletal space. That's really, so think at the end of the day, the ability for us to do like your heartbeat, beat by beat, we can do rep by know how you are progressing. We want to get into strength of the joint as much as we are focused on the flexibility of the joint. So we want to build a very deep musculoskeletal portfolio.
Interesting. Okay, I like that. And my last question for you will be your exit strategy. What do you hope? How do you hope to exit this company for the investors?
So at the end of the day, if we look at scaling this, there's a fork in the road. One is, look, there are existing strategics who really have grown through acquisitions. If you look at the big players in orthopedics today, whether it's Stryker or Johnson & Johnson, DePuy Synthes, and so on, their growth strategy is an acquisition-led growth strategy. I know this better than anybody else because I came from Cisco Systems, and that's really how we did this, right? And I'm looking at that same playbook on one side, which is beginning to cultivate and get us in front of these strategics so that they understand where we are and keeping them updated, and should they choose to already work with us from a go-to-market and eventually into R&D. That's really what my conversations are, because then I'm already digital matchmaking to suitors. On the flip side, the other fork in the road for us, Orrin is working together with you and Gary Goldman, is to look at expansion possibilities, because we've already had people coming in asking us for post cardio recovery, post minimally invasive cardiothoracic surgery recovery, and so on. We as a startup are very focused on what we're doing in musculoskeletal, and that's what we're sticking to. But if there is a growth opportunity, then the need to raise the right amount of money to go address it is a choice point that the board and us can make together. And that's really how we thought about this.
Okay, very good. This has been a pleasure, Raja. You are a natural on camera. I think we covered everything that I was hoping to go through today. Is there anything that you wanted to mention at the tail end of our interview?
No, mate, this is good. Thank you for doing this. Thank you for the opportunity.
This was really great. We're going to edit this down a little bit and put this up on the web so that people can see it at GHIN. And I really appreciate your time. And
Thank you so much, Aaron.